Anyway, we are very excellent आणि काय म्हणतात नॅशनल लेवलचे, नॅशनल लेवल नाही, वर्ल्ड फेमस पीडियाट्रिशियन, व्हेरी गुड ओरेटर, व्हेरी नेहमी आपलं व्याख्यानात नेहमी त्यांचे शायरी असते किंवा आपलं स्टोरी असते, असे आपले खूप छान बोलणारे आणि प्रत्येक सब्जेक्टला एकदम इझी मध्ये समजावून देणारे आजचे गेस्ट स्पीकर डॉक्टर दाभडकर सर. आणि आम्हाला असं वाटतं की वी आर लुकिंग फॉरवर्ड टू अवर फ्युचर IAP प्रेसिडेंट. मला बोलायला हरकत नाही वाटत असं, अँड ही शुड गो फॉर इट ॲज अ फॉर फ्युचर IAP प्रेसिडेंट. विथ दॅट ऑन नोट, and I welcome all the delegates which are there for attending today this seminar, as well as I'm thanking Sanofi Pasture, Mr. Milind Karkhanis as Anil Joshi, Sanofi Pharma, Milind Karkhanis as well as Anil Joshi, Mr. To organize this fine webinar for us on vitamin D. With that, I ask our President Saiba to give our opening remarks, and after that, our guest speaker, Dr. Dabhadkar sir. Please.
Anybody wants to speak, or should I start?
President, opening remarks by President.
Oh, so Dr. Dabhadkar sir is going to speak on the role of vitamin D in immunity. Sir, I welcome you all, and over to Dr. Dabhadkar sir. Sir, you may begin your talk, please.
So my friends, it is really pleasure to meet you all. खरं सांगू का, हा वेबिनार ठेवण्याचं कारण एकच आहे की 4 लोक भेटले की मला जरासं बरं वाटतं, थोडं धीर येतो. अदरवाईज असं वाटतं जसं आईला असं वाटतं नाही की बाळाला असं वाटतं आपली आई आपल्यापासून दूर दूर चालली का काय, बरेच वेळ दिसली नाही. It is like that. It is really pleasure to meet you all, especially Raigad IAPians. Just I was praising Raigad IAPians on so many grounds. The topic given to me, I don't know, every time I get some different topic. And last time we talked on probiotics and prebiotics beyond gut. Now we know vitamin D, and generally we talk on vitamin D in context with rickets. But this time also topic is totally different, and we are going to talk on vitamin D and immunity. It is somewhat difficult task as such, because I really love the synthesis of vitamin D. I vividly remember my Nelson book, maybe 12th, 13th edition, maybe something like that. And it was very good figure was given there regarding this vitamin D. I searched so many editions of Nelson, and I could not get that figure, which was very, very typical of the synthesis of vitamin D. As you know well, I would like to dedicate this lecture to one of the beloved, very good senior pediatrician. He is no more with us, Dr. Kapse. Probably everybody of you know who were there. I don't know. Abbas Sahib was there, and we heard Dr. Kapse in Raigad district, and he talked regarding vitamin D. He has given a lot of lectures on vitamin D. I know that is very difficult when we remember this Dr. Kapse, because he was a very great person. Still remembering him, and I devote this lecture to Dr. Kapse from Surat. Vitamin D, as I was saying, we know vitamin D, we know regarding only rickets only. But as days passed, lot of research was done, and now it is said that vitamin D is useful in so many conditions. We should give vitamin D in so many conditions. Before starting this lecture, I would like to take two names: Elmer Werner McCollum and Stanbach Harry. They invented, even Elmer Werner McCollum, both are from America, and he is Elmer McCollum. The name given to him was Mr. Vitamin by Times publication. Why? Because he has done a lot of research on this all vitamins as such. He created a laboratory, rat laboratory. He created rickets in rats. It's really, I don't know, it's really difficult, and we should be always thankful to all these research persons. He created laboratory of rats of 300 rats. Laboratory of rat. He created rickets in them, and then he has given some different 40 types of diet to them, and then he invented one diet. And as D was available at that time, D alphabet was available at that time after A, B, C, and he named it as vitamin D. His Stanbach Harry, so he's from States. We know irradiation of vitamin D by ultraviolet rays. Again, he has done a lot of work on so many things, especially vitamin A, fat soluble vitamins. Probably the credit of this all fat soluble vitamin goes to Steinbock Harry, maybe after First World War, 1918, 1919 to 1935. He invented a lot of vitamins. As I was saying, synthesis of vitamin D is really interesting and very good. Of course, it's difficult also. But if we look to this cycle, probably everything becomes very, very clear. As you know well, probably my arrow, yes. This is skin. 7-hydrocholesterol with the solar ultraviolet lights, it is converted into pre-vitamin D3 in skin. In other, if it gets absorbed, this is the pathway and this cholesterol produced. We will not go in this pathway. In skin, provitamin D3 is present. A spontaneous isomerization, it leads to cholecalciferol. Remember that all the time we will talk of this cholecalciferol. Again, this cholecalciferol is not useful. Remember that it is not useful. It goes into liver. In liver, it is called as hydroxylation, carbon molecule attached here. This is vitamin D3 coming from skin. This is vitamin D3 coming from diet, and it goes into liver. And in liver, there is one hydroxylation, 25 hydroxylase, and the molecule created is 25 hydroxycholecalciferol. D means cholecalciferol. In this, again, this 25 hydroxycholecalciferol, it goes into kidney. That is more important. And then in kidney, I don't know, Hemant, ह्या ह्याच्यात
बोला सर.
हे इथं बाजूला माझे फोटो दिसत, त्याच्या बाजूचं मला काहीच दिसत नाही. बरं जाऊ दे, मनाने जेवढे ते ठोकतो, म्हणजे तुम्हालाही कळणार नाही मलाही कळणार नाही. चलो जातो. So this goes in kidney and it's really, I remember my MD Nelson, when it goes into kidney, this is again there is a 125 dihydroxycholecalciferol is produced there, or 24-25 dihydroxycholecalciferol. Remember, it was 1 hydroxy, 1 D, and now there are 2 carbon chains are there. Either it is 125 or 24-25 dihydroxycholecalciferol. Remember that this 1 hydroxylase, which is not gone into kidney, it goes into circulation, and in circulation, I don't know, I am not, just wait.
सर तुम्ही ना ते स्पीकर व्ह्यू करा, म्हणजे एकच फोटो तुमचा दिसेल, तेही तुम्ही कमी करू
नाही, मला तुम्ही दिसायला पाहिजेत ना, तुम्ही सगळे दिसा मला.
बरोबर.
And then it is converted into, it goes into so many cells, breast, colon, lung, prostate, skin, everywhere. And from kidney it goes to endocrine, and probably this endocrine action, and this dihydroxycholecalciferol, 125 dihydroxycholecalciferol or 24-25 dihydroxycholecalciferol from kidney, it goes into blood, and it acts on so many systems. Since the vitamin D, as I said, this is still simplified. This comes from diet, this comes from skin, this is D3, D2. This goes to liver. In liver, 25 hydroxycholecalciferol is produced. This hydroxy, 1 hydroxy or 25 hydroxy, then bound to DBP, means vitamin D binding protein. It goes to kidney. And from kidney, there is second hydroxylation takes place. Either 1 alpha hydroxylation, second hydroxylation takes place, and this is 125 dihydroxycholecalciferol. Again, we will study this. Probably when I studied Nelson in my undergraduate days or postgraduate days, this term was not there. Vitamin D, I'm sorry. Vitamin D receptor, it goes into mitochondria. Some genes are affected there, and it becomes very active after that. Again, this is the same figure which I have taken from some of the, borrowed from Google, and probably this is the same. I will not go into detail. This D3 coming from diet, intestine, liver. From liver, it goes to kidney. From kidney, it is 25 dihydroxycholecalciferol is produced. And in mitochondria, there is VDR or RH. These complexes are formed. Remember that we should remember this VDR, vitamin D receptors. So we don't need only vitamin D, but we need vitamin D to avoid so many. This is nucleus. Remember, it goes into nucleus. Cell wall is not visible here, and it starts acting. This is in this blood, this 25 hydroxycholecalciferol, which we have studied, it goes into kidney, and from kidney, remember this from blood 25 cholecalciferol goes into macrophages or macrocytes, and again there is one cycle, and this 25-hydroxycholecalciferol is degraded, or it forms these complexes with vitamin D receptors, and this goes into these cells, lymphocytes, T lymphocytes, and we know well that T lymphocytes and B lymphocytes are most important as far as immune system is concerned. We are saved many times because of this T lymphocytes and B lymphocytes. Immunology we will study later on, and because of this we get protected. From blood, it also goes to parathyroid gland, which we know this function, and from parathyroid gland, calcium, phosphorus, hemostasis takes place. Kidney, from kidney, this dihydroxycholecalciferol, it goes to insulin and it acts for insulin. So what happens with this? Yes, as I said very correctly, we will not discuss all other things, but this is important in innate immunity. Probably you know well that there are two types of immunological system, or immunities are there: innate system and acquired immunity and innate immunity. We will see later on. This immunomodulation, when it goes into T activated T lymphocytes. This is, as I said very just now, this parathyroid hormone regulation and calcium metabolism more important. It goes into kidney, and remember, this is blood pressure regulation. It goes into pancreas, and blood sugar regulation, blood sugar control is there. When Dr. Kapsi was telling, and I vividly remember that when he was talking something, I said, sir, ye vitamin D kahan kaam aata hai? You take name of every system, Dabhadkar sir वैसा ही है. मतलब आप खाली ऐसा जहाँ बाल नहीं हो वहाँ बाल आते हैं, और जहाँ बाल है वहाँ बाल जाते हैं. तो Dabhadkar, you will get this information once upon a while, that probably vitamin D is the most important vitamin of all vitamins. Rather than discussing rickets and everything, just 1 minute. Rather than talking on vitamin D and rickets, as our topic is immune system, immunology, and why vitamin D is important nowadays. Even there is a lot of discussion when we are treating cases of COVID. Not rather than treating, because I don't treat COVID cases, I don't see even COVID cases also. But more important that there is a lot of discussion of COVID and vitamin D. So we should know what is its exact role. Of course, as far as COVID is concerned, it is not only we will see it later on. This is innate immunity and adaptive immunity. This is defense system, and we have these two systems, innate and adaptive system. What is innate? Innate means natural. Innate is primary immunological system. Most of the time, this is seen in insects, seen in bacteria, different bacteria, seen in fungi, seen in plants. And this innate is probably primary immunological system, which is now in as evolution takes place, this is converted into adaptive immunity. So innate immunity against foreign bodies, injuries, and pathogens, which you know well, bacteria killing substances, maybe in our salivary gland or everywhere. Then on the skin, as you know well, skin is the most protective barrier. Then over mucosal surfaces, maybe gastrointestinal or whatever mucosal surfaces, which get exposed to so many foreign bodies, and scavenger cells, dendrite cells, which we know well. But remember that this innate system is not very important. Its importance lies that this innate system sensitizes adaptive immunological system. Remember that all in these steps, vitamin D is most important ingredient, and as we have seen, VDR, vitamin D receptors are most important, they are needed. What is the difference between innate and adaptive? Because adaptive is somewhat advanced. As you know well, T cell, B cell, they have some memory, and that is either this memory may remain for a few months, maybe few years, maybe lifelong. But this is the advanced system in which defense cells in the B lymphoid cells, T lymphocytes and B lymphocytes, they produce antibodies. To produce these antibodies, am I audible? To produce these antibodies, vitamin D is needed. We will forget all this theory, whatever written in this slide. We are least concerned, but we will see this. This is cell wall. This is, as I said, 1-hydroxycholecalciferol. I'm sorry. Here is one hydroxycholecalciferol. This is one hydroxycholecalciferol. This comes because it's hydroxylation or chemical reaction. 1-alpha is converted into 2-dihydroxycholecalciferol. This gets attached to this vitamin D receptor. It is not only vitamin D is important, or vitamin D receptor is important. Then it goes into mitochondria, where there are different genes are present, almost 700 genes which govern vitamin D, and the complex is found vitamin D receptive and RXR. These are some genes, and because of these genes, there is tissue specific responses are present. Remember that again, I tell you, it is not only 125 dihydroxycholecalciferol or 1-hydroxy, but what is important is the complex which is found because of this vitamin D receptor, vitamin D and RXR. Okay. Yes. Tissues that express the vitamin D receptor. जैसे मैं बोल रहा था कि गली गली में ये vitamin D है, वैसा if we see all these tissue that express vitamin D receptors, means they have vitamin D receptors, they can produce or they must have this vitamin D receptors. Otherwise, this organ will have some problem. And if you study this, if you read this list, right from adipose, adrenal, bone, this is alphabetical, probably eggshell, hair follicle. Remember the intestine, ovary, pancreas, parathyroid, pituitary, parathyroid, thyroid, pituitary, prostate, retina, up to uterus and yolk sac. Remember that in all these systems, vitamin D receptors are present, and vitamin D is needed for activity of all these organs. Yes. Good evening. Jain sir, good evening. Jain sir, good evening.
Good evening.
Role of vitamin D, innate immunity. As we say, we have seen right now that there are two types of immunities are there: innate immunity and adaptive or advanced adaptive immunity. Vitamin D in innate immunity, as I said, though this is primary, innate immunity is most important to activate this adaptive immunity. Innate immune system response involves the so and so antibacterial response by neutrophils and macrophages. Remember that macrophages or macrocytes, they engulf the cells. There is some term, and this is needed in all these things. Vitamin D is really needed in the, as I said, lymphocyte cells from the adaptive or acquired immune system. Again, this is very complicated. I will not read all these things. I don't know, but this figure is very interesting, and probably this figure will give us a lot of information. So this is Toll Plaza. When we go from, now we are going from on 1st of November, we are going to Nehru. We will get lot of toll plazas there. Probably somebody will give us some coupons, and we will give this toll plaza while going to Dr. Hemant Ganguly on 1st of November. So remember that this is also toll plaza. Okay, this is cell wall. This is cell wall. We will not discuss in detail. This is toll. It is toll-like receptors. Even name is same. Toll-like receptors 1, 2. From here, either these bacteria may come, or they may come directly from cell. They may come directly from cell. What happens when they come here? When they come here, this nucleus. This is nucleus. This is mitochondria. Hello. Karkhanis, suppose I am taking a lot of time, just please remind me, because this cycle is very important rather than all these things. I really like this. This is vitamin D receptors, what I said. This is 1-hydroxylase. 1-hydroxylase. They go into mitochondria. 1-hydroxylase is present in mitochondria. This 25-hydroxycholecalciferol and 1-hydroxylase. There is hydroxylation. And from this hydroxylation, 25-hydroxycholecalciferol and again dihydroxycholecalciferol, this goes here. This is vitamin D. Vitamin D receptor, that is more important. This vitamin D receptor goes into nucleus again, and all these substances are created, with which is autophagocytosis. Just I was forgetting this term, autophago, and these bacteria are killed. Remember that this figure is more important, because rickets are not only needed for metabolism of calcium, phosphorus, phosphatase, etc., but vitamin D has more role in immunity in this way. So this slide and this is more important. As we have seen, vitamin D and innate immunity or primary immunity. This is vitamin D and adaptive immunity. And as we have seen in figure, there are B cells and T cells. Okay. B cells are produced, of course, both these cells are produced in bone marrow, but T cells travel to thymus, and after traveling thymus, they are converted into T cells. I'm sorry, these lymphocytes, primary lymphocytes, which may produce progeny, we will say progeny. These lymphocytes go into thymus and they are converted into T cells. Again, T cells and B cells, they go in so many systems, and especially in bursa, they are converted into B cells. So T cells go into thymus, B cells go into bursa or bone marrow, and they are converted to T and B cells. But this is not sufficient. Again, T cells are divided into T helper cells and so many progenies of this T helper cell, which are more important. T carcinogenic cell, T something toxic cells. There are so many types of these T helper cells also, and they are important in malignancy. They are important in immune system. They are important in diabetes. They are important in preventing so many diseases. So remember that all vitamin D is more important in this. मैं जैसा आपको बोला था, अगर विटामिन डी से बाल नहीं आते तो उसको बाल आते हैं. इवन आई एम ट्राइड, बट मुझे कुछ बाल से कुछ मेरा ये नहीं होगा. स्टिल मैं जैसा बोला कि दिस विटामिन डी इज वेरी इंपॉर्टेंट in all these systems, and they found, as you know well, that 30 we take 30 as normal. Where is it? Yes, 30 as normal limit here. 20 less than 30 it's insufficient, and we read reports 40 is good, 60 we generally need, 80 that is sufficient, and that is need of the time. When these vitamin D levels are there, even at 20, chances of tuberculosis are less. Experiment was done on macrophages, in which this some vitamin D products were acted, where these macrophages were exposed to this vitamin D, and it was found that whatever toxic cells are there, toxic tuberculosis bacilli are there, their growth is definitely prohibited by this vitamin D. Hypertension, as you know well, heart attack. It is said that chance of heart attack in persons in which vitamin D concentration is normal, chances are still less. Pancreatic cancers are less, renal cancer, colon cancer is less, and we have seen why it is less. There are so many cycles are there, but most important is this influenza less. Low birth weight, we'll see later on why. I would like to know from you that why we give vitamin D to every newborn babies. When I started my practice, maybe in 1990, and before that I was lecturer a few years back. Vitamin C, probably so many senior pediatrician, Jain sir may be knowing that, even to some extent Hemant Gangulia must be knowing that vitamin C was very popular at that time. Vitamin C and multivitamin, probably Secon drops were there. Now we stopped giving vitamin C and we have started giving vitamin D, because there is lot of importance of vitamin D in newborn babies also. Vitamin D in prevention of RTI, as I said, immunological system, primary immunology system, secondary immunology system, and so many papers are published, and they said that it is believed that vitamin D increases the production of natural antibodies. It stimulates T cells and B cells. Immunity by strengthened immunity. It is also positive. Vitamin D enhances the phagocytic activity of macrophages. Again, macrophages. Phagocyte is the most important work. Dendrite cells, we will study later on. Mature dendrite cells, they are converted into mature dendrite cells, and mature dendrite cells are more important in this primary immunity. And even it is said that in this paper, whatever we are published, where details are there, vitamin D enhances the phagocytic activity of macrophages. As we know well, 70% of our illnesses are probably viral, and remaining are 30% are bacterial as far as infections are concerned. In such cases, if we can prevent these viral illnesses, I don't know whether they have given it here or not. Somewhere I read that in CDC, CDC, disease prevention, communicable disease prevention or communicable disease center or something like that in America, they have done study on this cord blood, and cord blood mein vitamin D kitna hai. They have calculated this, and they found that in infants where cord blood vitamin D was less, they had 6 times more viral infection as compared to others. Same is with this RTI, same is with this CAP, community acquired pneumonia. It was found that whenever these community acquired pneumonias were studied, they found that vitamin D was categorically less in all these babies. And when we give vitamin D, when we add vitamin D in their diet, or when we give supplementary vitamin D as a drops or as a syrup, whatever it may be, chances of community acquired pneumonias are very less, whatever they have written. Yes, CDC, they have written disease control and prevention, CDC, Center for Disease Control and Prevention. When newborns with low vitamin D grow up to 1 year old, they have 6 times higher risk of suffering lung infection. So they have given here. Frequent respiratory infection, a randomized and double-blind study. Again, they have proved that supplementation, if we give supplementation of vitamin D3 in all patients who have recurrent infection, probably chances of this infection are really less in all those babies. Vitamin D and neonatal immunity. Yes, just I was saying, low cord blood concentration have been associated with respiratory syncytial virus, bronchiolitis, and respiratory infection. Not only viruses, but but there is definite role of bacteria is also one thing. And second thing, yes, they have asthma. I don't know exactly. Immunology. So many autoimmune disorders. Now there is role of autoimmune disorders. Maybe rheumatoid arthritis. Maybe so many things. Chances of development of these autoimmune disorders are very less. Similarly, chances of asthma are very less in these babies. Then why we are deficient in vitamin D? मुझे तो ऐसा लगता है अगर ये पूरे ग्लोबल में विटामिन डी सबको दे दिया तो शायद सब इलनेस कम हो जाएगी और अपना धंधा भी कम हो जाएगा. That is different story. But why there is deficiency of vitamin D? Latitude, yes, where that patient lives. Cloud cover and atmospheric pollution. That is the most important things now. Probably I don't know whether you have seen news in Delhi. They are facing very bad days nowadays because of this cloud and pollution. Here I can give one example of my son. My son Kedar, he's chemical engineer. He lives in one of the city, Seattle. He lives in Seattle. He lives in Seattle, and Seattle, it is very compulsory for all of them because there is all the time raining, and it is very compulsory for them to take vitamin D every 6 monthly or every monthly, something like that, and we are giving. It is because of this cloud cover there. Customary dress and sunscreen, we have seen that so many communities or religions, it is said that they should be fully covered. They never get exposed to this vitamin D, and chances of we were saying chance of rickets were more in this community, but nowadays we can say that all these diseases are very common. Yes, time? Yes, still there are 15 minutes. How much sun exposure should be given? Why this is important? As I said that he got some prize or something like that. Steinberg, who invented that ultraviolet rays are most important. But how much ultraviolet? Where this, let me tell you one thing very clearly, that suppose patient develops vitamin D deficiency, he has some disease, and vitamin D levels are very less. Remember that they will never get cured with this only exposure to ultraviolet rays, and they must be given vitamin D supplementation. What is the best time for sun exposure? Maybe, but ultraviolet rays should be more. What percentage of body surface area should be exposed? Maximum maybe 60-70%. Duration of exposure in winter and summer, again, as you know, where it's all the time confusing. But it is said that 5 minutes to 30 minutes twice in a week. Maybe in summer. Maybe time should be more in winter season because so many reasons. So this should be exposed. Age. In old age, vitamin D synthesis may be less as compared to younger age. Amount of vitamin D obtained from diet. Remember that diet. There are very few dietic. Now, Dr. Wankhede is. I am sure he will ask me, sir, किसमें वो vitamin D रहता है? तो probably Wankhede will answer that. But amount of vitamin D obtained from diet. Which is the best diet? This is very bad news for Hemant Gangulia. Best diet for vitamin D is fatty fish. Fatty fish. So in Konkan or I mean. Koli people, they will never develop this. Skin pigmentation, how skin pigmentation there, so that ultraviolet rays can irradiate this and sunshine intensity. IOF Nutrition Working Group. What is this IOF? This is International Osteoporosis Federation. I searched this. What is this IOF? Because when I was searching some references for this vitamin D, a lot of references were there from IOF, and so I searched this IOF working. They say that while 1-hydroxycholesterol level below 30 milligram are common in most populations, levels below 10 nanogram per ml, which constitute frank vitamin D deficiency, are most commonly seen in populations at risk. In particular, the elderly people like me, or few people like who elderly people are there. In some regions such as South Asia, we come in South Asia and Middle East, frank vitamin D deficiency is common in all age groups from neonates to the elderly. So remember, this is not observation by any of us. This is observation by International Osteoporosis Federation. Given the proposed definition, it is possible that population at high risk will have to resort to supplementation to achieve desired 20-hydroxycholecalciferol. I vividly remember some maybe 3, 4, 5, 6 years back, I had severe joint pain, shoulder joint, frozen joint was there. And I went in some institute, and first time they have done my vitamin D, which was less. May not be this remarkably less, but it was less. And when I have taken vitamin D, I improved a lot. So probably older age patients should take this. Skin color and important is very complicated. We will leave this. Factors affecting response to treatment, as I said, old people may not respond. Baseline 25-hydroxycholecalciferol concentration, as we have seen that even cord blood study was there. So baseline, if baseline concentration is just at very less, then probably it will take longer time. The variability in absorption because of so many diseases, concomitant diseases, comorbid conditions, the type and duration of the vitamin D used. This is very important, my dear friend, because next few slides we are going to cover. Of course, that is the very the type and duration of the vitamin D used. I would like to say type. What is more important is nanoparticles get absorbed better. Nanoparticle, we give vitamin D, but if it is nanoparticles, probably it will have better effect. And patient compliance, many times we see that patient compliance is not good, and that's why vitamin D, to start with, we ask to take weekly, and then monthly, because compliance may not be good at present. Monitoring, I will not go in that. Once you do vitamin D, it is not necessary to do vitamin D level every weekly or monthly. You can repeat after 2 to 3 months. Prevention and treatment of nutritional vitamin D deficiency. Remember that for prevention we may need lower doses, but for treatment we may need higher doses. When I was searching references from this vitamin D, remember that every association, every country, every group, they have their different recommendations for this vitamin D. Deficiency responds rapidly to treatment supplements, adequate ultraviolet radiation. Remember that it is not only ultraviolet radiation. I may not agree with this. It is not only ultraviolet radiation that is important, but you should give oral vitamin D doses. Most frequently treated with oral vitamin D3 or D3. A single large dose of oral administered vitamin D has been useful when patient compliance may be problematic. But remember that when you are giving high dose of vitamin D, as you know well, vitamin B complex or B complex, they are generally water soluble. एखादे बार अगर हाई डोज गया तो कुछ प्रॉब्लम नहीं हो सकता है. But if it is fat soluble vitamin, then probably if we give higher doses, it is very likely that patient may develop hypervitaminosis, which is more dangerous. and probably one condition, vitamin A and pseudotumor cerebri. I don't know whether vitamin D excess will lead to pseudotumor cerebri, but I have seen few of the cases of vitamin A where this was given regularly, daily basis, when government advises monthly or something like that. And remember that while you are giving high dose of vitamin D, you should remember this. Indian pediatrics recommended 60,000 units vitamin D weekly for 6 weeks. They have recommended, but remember, it is not in infants. It is not in early infancy. Healing occurs more rapidly by larger doses. Please don't go for these larger doses because these are really dangerous. Exposure to sunlight, principal source of vitamin D, but not much effective vitamin D deficiency. As I said very correctly, that if vitamin D deficiency there, probably only this vitamin D or sun exposure will not be sufficient. As far as diet, yes, fish diet or whatever, green vegetables, eggs, and so many things are there. But if patient is deficient, and as I said, Southeast Asia or South Asia, 7 to 80% patients are deficient in vitamin D. As we say regarding hemoglobin or anemia, our 70 to 80% children are anemic. Similarly, 70 to 80% of our population is deficient in vitamin D. But remember that only vitamin D or diet may not be helpful, and we have to give some supplementation, and that is most important. Okay, high doses 30,000 associated with hypervitaminosis. कारखाने साहेब तुमच्या आधीच्या या स्लाइड मध्ये जरासं कॉन्ट्रोवर्सी आहे. I was saying that this leads to high dose of vitamin A may lead to hypervitaminosis. Lower dose is effective in treating rickets without causing toxicity. That is more important. Slow but steady means there is probably that is most applicable here. Only cholecalciferol is available for the treatment of VDD in India. So it is taken orally. As I said, it comes from skin and it comes from orally also. But this cholecalciferol is sufficient. We need not to give 1 dihydroxycholecalciferol or 24-25 dihydroxycholecalciferol. But remember, even these molecules are also present, and probably they are used in some of the diseases. I don't know. Academicians from our group can throw some light. There is limited evidence to superiority of any particular regimen over others. As I said, so many regimens are given. In general, healing of rickets takes place over a period of 8 to 12 weeks. So you need not to repeat vitamin D levels every weekly. You can repeat after 12 weeks or 3 months. Treatment is aimed at achieving healing with adequate dose of vitamin D without causing risk of hypervitaminosis. Remember that don't jump onto, especially where pediatrician, and as far as possible avoid these high doses of vitamin D3, especially bulk doses which we give in adults 60,000 units per week or per month. IIP guidelines, again this is an older guideline, we give to all newborn babies 400 international units of vitamin D is sufficient for all purposes, and up to infancy. And now IIP says that this vitamin D should be given up to the age of 1 year because of so many reasons. IIP guidelines, we will not go in premature units, 400, almost 400. But 1 to 18 years, after 1 year, we can use 6,000, and at risk for so many reasons it is this. So by and large, up to 1 year, this is preventive doses. For treatment, 1,000 international units, 2,000 international units in new premature. If your cord blood says that patient has vitamin D3 deficiency, otherwise, we will not very rarely, or we will not get signs of vitamin D deficiency in neonates. If you have done, generally we don't do cord blood vitamin D3 level. We will start one project in the Raigad district also. But vitamin D3, these are the higher doses are needed. In 1 year from infants to adolescent, we can give quite high doses. But remember that 1,000 to 2,000 doses, 2,000 international units are quite sufficient. Again, these are different groups which we have recommended something different. Protocol treatment of vitamin D. We have seen recommended doses or normal the requirement, whatever it may be. But when we see case of vitamin deficiency, now I will not say only rickets, because rickets is one of the manifestation of vitamin D deficiency. But if there are some other manifesting chronic illnesses there, and if we do vitamin D3 level, we can give 1 year 800 to 600, 2,400 international units, and from 12 to 18 years 4,600 units. Remember, in all these cases, we should give vitamin D3 only for 12 weeks and not like infancy that we give for 1 year. Otherwise, patient will develop hypervitaminosis. So give only for 2 weeks. Intermittent dosing, as I said, not recommended below 1 year. Above 1 year, 60,000 units, 1 in 2 weeks for 8 to 12 weeks, and then 60,000 units per month for 1 year. I was planning to do one study when I received this slide. We give lot of calcium preparation. I will not take any trade names as such, but whether they have sufficient, it is always written that vitamin D3 so and so, cholecalciferol, this. But is it sufficient? And this study found that only 28.6% of the preparations vitamin D was in acceptable range. Otherwise, remaining almost 70% of the cases, this vitamin D is either excess or less. So I'm sorry, friends, I could not study this calcium preparation. I would have prepared a separate slide for that. So many company, they have this vitamin D3 this level. This company, they have this vitamin D3 level. And whether we really give that much vitamin D3 or not. Now we are coming to the last few slides. What is time? There are still 5 minutes are there. Just I will finish within 2 or 3 minutes. Vitamin D and challenges in absorption. Why we are discussing this case? Crux of the problem. How it gets absorbed. We give vitamin D, but whether we know whether it gets absorbed properly or not, and that's why these studies were done. That this is one pathway. This is one pathway which is called as intracellular from two cells. Paracellular from 2 cells. I'm sorry. This is intracellular. This is intracellular, but receptor mediated transcytosis. So vitamin may get absorbed in this from this paracellular, from this intracellular, or from this intracellular receptor pathway mediators. Remember that our routine vitamin D may not get absorbed because of this. Again, there is role of fat. Generally, we have to give a high fat meal. Ghee ke saath de do. Not in infants, but elderly, we can say that take with ghee, because absorption is much better because it's fat soluble vitamin D. If we give without ghee or without fat, then probably absorption is less. Absorption nanoparticles. And I was saying this thing that vitamin D should be given in nanoparticle basis, in nanoparticle formulation. If we want to have proper absorption, if you want to have proper utilization of vitamin D, then it should be given in this nanoparticle basis. And this nanoparticles, nanotechnology, probably all this technology may be new for us, but there is a lot of discussion in Western countries regarding these nanoparticles in all medicines. If we give this in nanoparticle, I will not read this slide, whatever it read, I don't know, hence their absorption is not fat dependent and unaffected. So if we give nanoparticle, then it gets absorbed through this paracellular route, through this transcellular route in both ways, or persorption. So it gets to this blood capillary in all these. If nanoparticles there, it gets absorbed fully. Bioavailability nanoparticle is 3 times higher than the uptake. So remember that if we get any pharma company with this vitamin D preparation, now we can ask whether you have this preparation of nanoparticle, and probably this is the preparation which has these nanoparticles. Of course, I will have to use also. I haven't yet used. Formulation form of nanoparticle. They have given advantage of nanoparticle because it gets only crux. Whatever lines are written by so many people, only crux of the problem that nanoparticles are much better for this prescription. Conventional nanoparticle you can take with milk, you can take with fat, you can take with water, you can take with anybody. But absorption is highly palatable and ready to drink in short. Results are assured in fed as well as fasting state. Okay. So, my friends, vitamin D effects on innate and adaptive immune functions encompass so and so, whatever it may be. I want to tell you that role of vitamin D is not only in prevention of rickets or calcium metabolism, phosphorus metabolism, but vitamin D is more important in all these things. And moreover, when there are recurrent infections are there, when we suspect immunity is less, when we think that some malignancy is there, when we are treating some autoimmune disorders, probably there is a more role of this vitamin D, because it stimulates dendrite cells, it stimulates T lymphocyte, it stimulates T helper cells, it stimulates B cells, and this is categorically proved. So this is this. Thank you very much, my friends. Thank you so much.
My question is, which level to be checked, whether vitamin D2 or D3 level in the blood?
Cholic
Why
acid,
D3, why not D2?
D3, cholic calciferol. D3, cholic calciferol, no
Sir,
doubt.
sir, extending that question, how do you diagnose vitamin D deficiency? How do you diagnose? How do one diagnose the vitamin D deficiency?
Yes, Dr. Hemant Ganguly, I definitely agree with you that how it should be diagnosed. And previously, as we were students, and then I was lecturer and practitioner or something like that. The only thing which we were knowing is rickets and manifestation of rickets. Nowadays, clinically, it is very difficult to say. Apart from rickets, I don't think vitamin D deficiency manifests with this. But we should suspect when there is recurrent reflux infection, when there is this, when there is some osteoporosis in old age. We don't see generally, unless until it is some metabolic disorder, osteopetrosis or osteoporosis. These are a totally different term. But when recurrent infections are there, apart from all these things, मुझे ऐसा लगता है at present, after studying this vitamin D3, we should do serum level of vitamin D3, and there are no clear-cut symptoms. ये है तो vitamin D है, as we see in the vitamin A deficiency, we get lot of this skin changes है, ophthalmic changes है, phrenoderma है, keratomalacia है. It is not same in vitamin D3.
So, sir, whether you recommend whether we should do vitamin D3 levels at specific age or time, or should we monitor vitamin D3 levels on a regular basis in our pediatric practice?
Generally, Dr. Hemant Ganguly, I have seen that suppose you go for your chronic illnesses in any of the institute, they first ask vitamin D3 level, vitamin B12 level. Those who are working in metropolitan cities, probably they may be better aware of this. And in such cases, vitamin D3 should be given. As far as monitoring is concerned, well, if it is less, we should give. And 70% population is less. As far as monitoring is concerned, every time we should not do vitamin D3 level every weekly or every fortnightly. But it should be repeated after 3 weeks, because we complete treatment after 3 weeks, and it should be done after 3 weeks.
So in veg and the persons who are having totally veg, we should do vitamin D. The person is totally veg.
You should do vitamin D. Regularly you should do vitamin D3 level.
Sir, मी विचारतो, you are talking of cord blood level of vitamin D. If it is low, should we know the status of mother of vitamin D level?
Of course. मैं एक बात बोलना चाहता हूँ, मैं एक आपको बात बोलता हूँ वानखेड़े साहब.
हाँ सर.
Maximum we have seen rickets in premature babies. Okay, why? Because it is said that maximum calcium and phosphorus absorption happens in last trimester, in third trimester. Okay, so baby is premature. Definitely, baby will have this vitamin or calcium deficiency and vitamin D3 deficiency. Generally, we don't do that unless until we do some research or something like that. For research purpose, we can do vitamin D3 level of cord blood. Generally, we don't do. But in premature babies, it is must to give calcium as well as vitamin D3.
Yes, sir, but
yes.
in full term and infantile age, there is no need to check the.
Jay, one please, I'm finishing, please.
Hello. Jay. मला हे विचारायचं होतं की can we prevent this vitamin D deficiency in newborn, maybe premature, by enhancing the vitamin D supplementation to mother?
Yes, that's why it is supplemented to mother.
Third trimester of.
Right.
That is what I want.
But other thing, why we should supplement in infantile age serum D3 level वर बघायची गरज नसते, because that we itself know that vitamin D in the breast milk is not sufficient for the infantile age, right? That's why we supplement. But definitely, suppose you are supplementing above 1 year age, 1 year age, 2 or 3 year age, you should before supplementing, because there are always chance of hypervitaminosis. You should actually check vitamin D3 level, then supplement. Right? That is the thing. And sir already said, always 3 months you should give it and stop it. Right? Right.
Sir, I was just wondering if vitamin D has got so many immunological functions, like it increases innate immunity, it increases adaptive immunity, it presents macrophages and lymphocytes to improve adaptive immunity. And vitamin D is indicated in recurrent respiratory tract infections and maybe a severe infection. But I would rather say that it should be indicated in all the patients who are admitted with infection in our hospital. Is it not like that, or it is only recurrent respiratory tract infection where we recommend this?
Dr. Rajendra Sandurkar, in this context,
Yes.
I would like to say you one thing. Forget this seminar and something like that.
Right.
A lot of reports are there whether the vitamin D is really useful in all these infections. Vitamin D and diabetes, vitamin D and malignancy. Say malignancy or cancer. They have done. And whether this coincidence that vitamin D is less because of this nutrition is not so good. Going, and they have given vitamin D. They found that all these patients were deficient in vitamin D. Does it mean that these diseases are caused by vitamin D?
No.
Probably no. Probably no. But remember that then when they have started this vitamin D supplementation, and they have published some papers also. Chances of infection or what way frequency of infection, what is term I don't, frequency of infection is definitely less when vitamin D is supplemented, and they proved that innate immunity and acquired immunity, T cells, B cells, and as I said, express the so many organs express vitamin D receptors. Considering this vitamin D, probably they will have a role. Probably they have a role in vitamin D, and in such cases, yes, we should try to supplement. And in chronic cases, मुझे भी ऐसा लगता है that in chronic cases we should do this vitamin D levels regular.
Okay. And sir, you said, sir, 8 to 12 weeks. In one slide also we saw recommended vitamin D is for 8 to 12 weeks. So after 12 weeks, you stop. And what do you recommend? Sun exposure or what?
Then after this, maintenance vitamin D is needed. Maintenance vitamin D they can get from their diet and sun exposure. It is not only sun exposure and diet, because both have this and this pathway we have seen that sun exposure, ultraviolet rays, vagara, one hydroxylase, one vagara, and it is converted into so. Yes, diet this. Then probably at that time sun exposure and dietic vitamin D is sufficient. But if patient has frank vitamin D deficiency or hypovitaminosis D, we will say, then oral or administration of this vitamin D is needed. After 12 weeks, probably sunrise and this will work.
Correct. Okay. Sir, what is the exposure time? Does it vary with thick, dark skin and fair skin?
Yes, exposure time. They have recommended that 5 to 30 minutes twice in a week. And tanning should be there. Now, so many ladies use these sunscreen lotions. So, ladies, the husbands of the ladies should ask their wives whether you want to look beautiful or you want to become rickety. If they want to become beautiful, they have to accept this rickets. But by and large, answer of your question is that it is 5 to 30 minutes twice in a week by and large. At the dark skin मध्ये किती मला नक्की नाही सांगता येणार वानकडे.
Sir, even uncontrolled asthma, they have said that they see the vitamin D level and supplement it.
Yes.
Yes, and other thing is, sir, one question, whether Corona period has increased the vitamin D deficiency in India?
One exposure to sunlight.
Yes, Corona and vitamin D. Now there is a lot of discussion over Corona and vitamin D. And National Institute of Virology or something. There are two institutes. They have done study. And they have done vitamin D level of every Corona patient, and they have supplemented. by and large, rather than only corona, which is one of the virus, it is found that it prevents so many viral diseases. corona is one of them. So remember कि कोरोना के लिए अपने को कुछ ये फॉर्मूला मिल गया है, ऐसा नहीं है. We can use any. So it is common with any of the viral illnesses, and same is case with corona. So कोरोना के लिए ही विटामिन डी यूजफुल है, ऐसा नहीं है.
Sir, a comment is generally, all syrup calcium which are available, they say there are 200 IU of vitamin D per 5 ml. Almost all preparations are in that tune of the range. So when we write vitamin D for first year of life, so vitamin D preparation 400 IU, then one writes calcium, then that's add 200 again to that becomes 600. And then again someone writes vitamin supplementation as bisyndrome, or I'm telling trade name, but because they are containing high amount of vitamin D, so that again adds up 200, probably 800 IU to 1000 IU are given sometimes when one writes syrup calcium, vitamin D as well as multivitamins. So what is the last dose which is recommended as a vitamin D per day up to the age of 1 year?
सर प्रश्न फार मोठा होतो, पहिले 2-4 वाक्य विसरून गेले माझे काय होते ते. Still I would like to ask you, just I confess that today even मेरे पास क्या क्या कैल्शियम प्रिपरेशन है, I cannot take this name, मेरे पास क्या क्या कैल्शियम प्रिपरेशन है. So this homework for us, उसमें कितना है, and as you said very correctly, Dr. Hemant Ganguly, is 200 international units per 5 ml. We have to confirm this. Then again we give this, Kulkarni madam has asked question in the chat box, what is recommendation in infants? In infants is 400 units per day. That means 200 international units twice a day. Probably that is sufficient. And suppose patient is getting and as I have shown that so many preparations have inadequate vitamin D, where we never thought of that. Now just I was studying this vitamin D and Karkhanis told me that you want to talk on vitamin D. I was searching references, and then I thought that I should do study, and probably all of us, even तुम कल से अपन chatting शुरू करेंगे कि एक preparation तो उसमें vitamin D कितना है, one thing. Second thing, suppose rather than 400 we give 600 or something like that, 800. Whether patient develops hypervitaminosis D, unlikely. Unless until we give bolus 30,000 units, 60,000 units, patient develop hypervitaminosis D. Even that is more dangerous. Okay. So recommended doses by IP are 400 internal units per day or 200 twice a day. So 8 drops of 400, whatever it may be, that is. But remember that nanoparticles are nowadays, they are saying nanoparticles are more important. And probably Sanofi is giving these nanoparticles. I will have to study that also.
So probably Kulkarni madam is asking therapeutic dose in infants, I think.
Let madam speak now. Madam bola na, madam vichara.
Daily dose of infants.
Therapeutic dose.
ओके वानखेडे सर, त्यांनी साधं विचारले, डेली डोस विचारलाय, तुम्ही थेरॅपेटिक तुमचं मनाचं टाकते. कुठे गेले वानखेडे सर?
डॉक्टर मॅडम कुलकर्णी सांगा ना, विचारा. डॉक्टर मॅडम कुलकर्णी, व्हॉट इज युअर क्वेश्चन?
थेरॅपेटिक डोस विचार काय आहे?
त्यांना बोल.
I will tell both of the doses. I will tell both of the doses. Sir, as I said, requirement is not per kg or something like that. Up to infants, it is 400 internal units. Therapeutic means, as Dr. Hemant Ganguly asked, what are signs and symptoms apart from rickets? We don't know. Recurrent infection, we do vitamin D3 level. If it is less than 10 nanograms per ml, then per liter, then we have to think seriously. And in such cases, as there are some slides, in such cases we can give 800, 1600, and this slide is given 800. 2000 international units per day. Should I go for that slide?
Yes. No, sir. 2000 per day.
1600 to 2000. Yes. For prevention, 400 in infancy, 400 international units per day.
Right.
As far as treatment is concerned, it's 1600 to 2000 international units per day for 8 to 12 weeks, and repeat this vitamin D level after 3 weeks, after 12 weeks.
Well, बरोबर.
आता भूक लागली ना भाऊ.
Last thing I want to ask or comment. आम्ही असंच एक प्रोजेक्ट केलं होतं जळगावमध्ये, भडगाव म्हणून एक जागा आहे, तिथे एक चॅरिटी ऑर्गनायझर तेव्हा मी गेलो होते. वी हॅव डन द विटामिन डी लेवल्स इन ऑल द चिल्ड्रन्स, almost study of 100 children, and we do find deficiency. So what I feel we should, I don't know what what the experts say, but we should be doing regularly on vitamin D3 levels on regular basis. I think so. We should do that way and then go further, because when we are not aware of the features, clinical features, just we are correlating with that disease is there, which is having vitamin D deficiency. So we are correlating that things. I think so. So on regular basis, आपल्याला vitamin D कधी करायला पाहिजे ते guidelines यायला पाहिजे असं मला वाटतं.
Hemant, I say that fortunately I got chance and now I am asked to examine some 250 to 300 malnourished SAM babies. Probably I will start this project within next month or something like that after this my tenure. But as a president, Indian Agri Pediatric Raigad districts are there. You are a past president. So many active people are there. I would like to say that Raigad IIP should take this project. If possible, we will do vitamin D of all 200, 300 babies. If permitted, नाहीतरी त्यांचं blood घ्यायचंच आहे. पण we will work on these babies on behalf of Indian Agri Pediatric Raigad district branch. I would like to involve you all. We will have banner of Raigad district. We will ask some funds from our IP and we will do this project. And again we will decide. For that, I would like to say, याच्यात आपल्याला काय रिसर्च प्रोजेक्ट करता येईल.
सर व्हॉट आय डिड, आम्ही केलं होतं ना ते मी तुम्हाला पाठवीन ईमेलने, आणि शिवाय द्यायला आम्हाला सर्व ब्लड इन्व्हेस्टिगेशन थायरोकेअर लॅबने आम्हाला ऍट अ फ्री कॉस्ट करून दिलं होतं. सो वी कॅन अप्रोच थायरोकेअर दे विल डू इट डेफिनेटली विल, बट वी विल हॅव टू form the project, and probably that will be a good project for the SAM and MAM babies. That will be the
very good. We will do that. We will do that.
बरोबर, आपण करूया.
आभार प्रदर्शन करा कोणीतरी आता. ओपन फॉर डिस्कशन. मी सांगू काय वाचल्याने ना मला खूप हे झालेलं की मला असं वाटतं की दिस इज व्हेरी गुड.
ऍक्च्युअली सर आपण परत एक पुढल्या अजून एक तुम्हाला देतो प्रेझेंटेशन. विल टॉक मोर अबाउट विटामिन डी इफ यू आर इंटरेस्टेड. We have a lot of data we are having of this vitamin D. So I think after Diwali or after first week of January, we can come back again and to discuss about vitamin D. I will give you the good presentations to you.
Thank you, sir. Thank you.
Presentations are there.
Thank you very much. तरी पण आज मी बरीच माहिती दिली ना, कशाला उगी परत.
नाही तुम्हाला तुम्ही आता इम्युनिटी बघितलीत, आता व्हायरल इन्फेक्शन, इन्फेक्शियस थिंग्स.
There are lot of papers are there. Yes.
So just for the discussion, we can put case studies and take a discussion forward. That is also possible. We have various case studies also of that. That will take forward that.
Yes, thank you so much. It's really nice of you and very kind of you.
Thank you, sir.